Okay, let's unpack this. Have you ever heard of obstructive sleep apnea, often called OSA?
Mm,
It's a sleep disorder, and it affects nearly 1 billion people globally. It's silently linked to all sorts of things, from cardiovascular issues,
yeah,
even traffic accidents.
yeah, it's quite serious.
And for many people, the most effective treatment is something called CPAP therapy. It uses a machine, basically, that helps you breathe while you sleep.
Continuous positive airway pressure.
Exactly. But here's the twist. Despite how critical it is, for health and safety, a lot of people really struggle to stick with CPAP treatment.
They really do.
We all kind of know the common reasons: discomfort, maybe mask issues, the noise, perhaps.
So those are the obvious ones.
But what if the reasons go much, much deeper than that? What if factors you'd never even expect, like, say, the weather or even your hairstyle, actually play a significant role?
Well, what's truly fascinating here is that traditional research seems to have often missed the full picture. A lot of studies have focused on a pretty limited set of variables.
Right.
And if we connect this to the bigger picture, it suggests we might be overlooking really critical opportunities to genuinely help people.
So this deep dive.
Yeah, this is all about pulling back the curtain on those hidden influences, really, thanks to some groundbreaking new research we've been looking at.
That's right. We're diving into a recent study that takes a really powerful mixed methods approach. It combines large-scale surveys with these in-depth patient interviews.
Qualitative and quantitative.
Exactly. To compile what might be the most comprehensive list yet of factors influencing CPAP adherence. Get ready for some serious aha moments, I think.
Mm-hmm.
We're about to uncover how everything from, like, fears of natural disasters to religious practices can unexpectedly impact whether someone actually uses their life-changing device.
It's quite the range.
So maybe let's start by briefly explaining obstructive sleep apnea. At its core, it's an upper airway obstruction. It happens while you sleep.
The airway collapses, basically.
Right.
Yeah.
And its impact is genuinely widespread. It affects about, 6% of men and 4% of women in the general population?
Roughly, yes.
Mm.
And it leads to serious risks, diabetes, neurocognitive impairments, definitely reduced quality of life.
So, left untreated, OSA is a critical public health issue, no question.
And this is precisely why continuous positive airway pressure, CPAP, is considered the gold standard treatment for it.
The go-to.
Yeah. However, its effectiveness is consistently hampered by, well, persistently low adherence rates. For such a vital therapy, people just aren't using it like they should.
You hear that right. The gold standard treatment, it isn't consistently delivering for everyone.
Unfortunately, no.
And when you dive into the well-known barriers, it starts to make a lot of sense why. We're talking about things like skin irritation from the mask,
Very common.
the mask simply not fitting right, or maybe leaking air, a dry throat or nasal congestion, that feeling of claustrophobia some people get.
Yeah, the mask can feel quite confining.
Then there are the financial costs, sometimes the device noise, and even just physical discomfort like the hose restricting movement in bed.
And you can't ignore the psychosocial barriers either. Things like feeling dependent on a machine or maybe experiencing stigma around using it.
That's a really good point. Stigma.
And what's also important to understand is how some of these factors are actually sort of double-edged swords. Take spousal involvement, for instance.
Okay.
It can be incredibly supportive, right? Offering encouragement and help. But it can also, unfortunately, lead to stigma or even intimacy issues for some couples.
I can see that.
We also see that just a lack of knowledge about how to maintain the device is a pretty significant barrier to mass compliance.
Like cleaning it, troubleshooting.
Exactly.
Yeah.
If you don't know how to keep it clean or functioning correctly or how to fix minor issues, you're much less likely to use it consistently.
Okay, so given all these known challenges, how did this new study manage to uncover even more? What did they do differently?
Well, it specifically tries to address gaps in previous research by using this robust mixed methods approach we mentioned.
Right, the surveys and interviews.
Yeah, they gathered quantitative data from surveys with hundreds of patients, collected really rich qualitative insights through in-depth interviews with dozens more, and they also reviewed a large number of patient records.
Wow, that's thorough.
It is. And this comprehensive data set, collected from a sleep center in Turkey, allowed them to deliberately focus on geographical and cultural factors, things often overlooked in, say, Western-centric research.
Ah, the location matters.
Absolutely. And this really raises an important question. Why have these significant factors been missed before? What do you think?
That's a good question. Maybe because they seem unrelated or too specific to certain groups.
Possibly. The study itself found that the existing theories and models were simply insufficient. They didn't capture the full scope of influences on CPAP adherence.
So the old models were too narrow.
Exactly. It highlights the sheer complexity of this. It proves adherence extends far beyond just the medical side or the technical aspects of the device itself.
That's a crucial distinction, isn't it? Makes you wonder how many other areas of health are missing these kinds of, unexpected pieces.
It does.
Now, here's where it gets really surprising. Let's talk about some of the novel variables this study uncovered for the first time. They identified new barriers to adherence, and the first one, it really stands out.
Okay.
Fear of natural disasters. Get this. Patients expressed fear of lightning and thunder during rainy weather, which made them anxious about using an electrical device.
That's interesting.
But even more significantly, there was a profound fear of earthquakes. It prompted some to actually stop therapy because they were anxious about escaping quickly while wearing a mask.
Wow. Okay, that's powerful. And you can see how deeply intertwined that is with daily life and unique regional contexts.
Definitely.
For someone living in an earthquake-prone area, that fear of being trapped during an emergency while wearing a mask, that isn't just a minor annoyance. It's a very real, visceral concern.
Absolutely. It's about safety.
It directly impacts their perceived safety and their willingness to use the device. That kind of factor just wouldn't show up in a standard clinical questionnaire, would it?
Not a chance. It reframes the whole conversation from just comfort to safety and survival. So what else did they uncover? Any other new barriers?
There were others, yes.
Like relocation, people struggled with finding appropriate space for their devices after moving house.
Ah, the practical stuff.
Yeah, imagine having your CPAP perfectly set up, in your old bedroom, only to move and find the outlets are in awkward places or there's no suitable nightstand. These seemingly minor logistical hurdles can become major barriers.
Makes sense. Friction in the routine.
And religious practices also emerged as a barrier. Some patients avoided CPAP during Ramadan, for example, to prevent fasting violations. And others experienced sleep disruptions just due to prayer schedules interfering with consistent use.
These are prime examples, aren't they? How health behaviors are just woven into the fabric of daily life and cultural beliefs. For someone adhering to specific religious practices, fitting CPAP use into their prayer schedule or fasting rituals, that becomes a genuine challenge. It's not just about compliance. It's about respecting deeply held personal values.
Right. And the relocation thing, while it seems minor, just introduces practical friction that can easily derail a routine.
Absolutely. What else?
Well, beyond those, they noted air pollution. Some patients reported difficulties using the device in areas with high air pollution, although findings on this were apparently mixed in other studies. Maybe the filters help.
Could be. Filters pretty good on modern devices.
And perhaps my favorite surprising one, personal physical attributes. Things like long hair, beards, mustaches. They caused entanglement with masks or affected the mask placement.
Slight chuckle.
Right. It just highlights the need for truly personalized solutions, doesn't it?
Yes, it's a great reminder that even something as seemingly unrelated as, a beard can make a life-changing medical device difficult to use effectively.
Definitely.
These findings really underscore the need for a holistic approach, considering the patient's entire lived experience.
Yeah.
But it wasn't all barriers, was it? There were also new facilitators, things that helped adherence.
That's right. Good point. On the positive side, they found that automatic devices, the ones with automatic pressure adjustments,
Auto CPAP.
they significantly enhanced ease of use and actually increased compliance. People found them easier.
Less fiddling, less guesswork.
Exactly. And surprisingly, rural residency was found to be a facilitator.
Really? How so?
They found that cleaner air in high-altitude rural areas like plateaus or villages seemed to improve comfort, leading to increased CPAP compliance.
Huh. Cleaner air, better experience. It makes sense, doesn't it?
Yeah.
If the air you're breathing through the device feels fresher and cleaner, it naturally improves comfort and maybe reduces the perception of the device as like a burden.
And the automatic devices,
Yeah.
that just speaks to ease of use, right? Reduces the frustration that can trip up new users especially.
It definitely simplifies things.
So it's clear the picture is far more nuanced than we might have thought. We've just peeled back the curtain on those really personal, qualitative insights.
The stories behind the data.
Exactly. Now let's zoom out a bit and see what the larger scale quantitative data confirms about these and other factors. Get the complete picture of what truly influences adherence.
Right. So the study identified several statistically significant negative impacts on CPAP adherence. things that lower usage.
Okay, what stood out?
Well, discomfort related to use, they categorized it as DRU. That was a
Yeah.
big one. Increases in discomfort like nasal congestion, device noise,
Yeah.
skin irritation. They consistently led to lower device usage rates. No surprise there, really.
Still important to quantify it.
Absolutely.
Yeah.
Then there were psychological and comorbid effects, or PCE. Psychological conditions, depression, anxiety, claustrophobia, even just feeling dependent on the machine.
Mm-hmm.
Alongside other health conditions like hypertension, they significantly reduced usage. We're talking decreasing adherence by almost 75% in some cases.
Wow, 3/4. That's huge.
It is. And interestingly, Epworth Sleepiness Scale scores the ESS, which measures how sleepy you feel during the day.
Right, the standard questionnaire.
Higher scores on that scale were actually associated with reduced adherence.
Wait, higher sleepiness meant less use. That seems counterintuitive.
It does at first glance.
Yeah.
But the thinking is, it suggests that if patients don't feel that immediate, noticeable benefit in their daytime energy or alertness.
Ah, if they're still sleepy despite using it.
Exactly. Even if it's helping their breathing, if they don't perceive that daytime improvement, a noticeable percentage, around 4% decrease in adherence per point increase, are more likely to drop off.
That's a crucial point. So managing patient expectations about when and how they'll feel better is just as important as the device itself.
Precisely. What about the positive impacts? What helped people stick with it?
Right, the facilitators.
Yeah, so on the flip side, there were statistically significant positive impacts. The Social Cognitive Theory Scale Average, or SCT.
Okay, what does that measure?
It reflects things like social support and self-efficacy. That's basically the belief in your own ability to use the device successfully.
Got it. Confidence and support.
Exactly. Improvements there significantly promoted higher CPAP adherence, more than doubling it, actually. A 2.49 times increase.
Wow, that's powerful. Social support matters.
Hugely. Similarly, a better perceived health status and quality of life measured by something called the Visual Analog Scale, or VAS.
Who's feeling generally healthier.
Right. That led to higher adherence rates, too, about a 1.5% increase per point. And finally, insurance coverage, cost, and accessibility, or ICCA.
The practical stuff again, money and access.
Yeah. Easier access to the healthcare system, having insurance coverage, lower costs that was significantly associated with increased adherence. It boosted it by more than 3 times, actually, 3.17 times increase.
Makes perfect sense. If you can't afford it or easily get supplies or support, you're less likely to use it.
It's a major barrier removed.
It's fascinating how the quantitative data provides the what, the numbers, and those qualitative interviews we talked about earlier give us the why behind them.
Exactly.
It connects the dots between, say, psychological effects and actual patient experiences with depression or stigma, showing the real human impact behind the statistics.
And all these complex findings, the quantitative and qualitative combined, led the researchers to propose a new, more comprehensive framework. They call it the Multidimensional CPAP Adherence Model.
Okay, a new model, what does that look like?
Well, it integrates 5 key dimensions, trying to capture everything we've discussed. First, individual factors.
Yeah.
Demographics, health literacy, BMI, other health conditions, self-efficacy, and even those physical attributes we mentioned, like long hair or a beard affecting mask fit.
Right, the personal stuff.
Second, psychosocial factors. That includes social support, patient expectations, psychological barriers like claustrophobia or fear of dependency, and stigma.
Okay, the mental and social side.
Third, technological and device-related factors. This covers the device design itself, mask compatibility, auto-adjusting pressure, maintenance needs, noise levels, hose discomfort.
The machine itself. Makes sense.
Fourth, environmental and geographical factors. This brings in air quality, seasonal variations, whether someone lives rurally or in a city, power outages, and those unique fears like earthquake anxiety we talked about.
Like a world around the patient.
Exactly. And finally, fifth, cultural and sociocultural factors. This includes religious practices like fasting or prayer times, cultural norms maybe around hospitality or traditional activities, economic constraints, healthcare access, and general public awareness of sleep apnea.
Wow. Okay, that covers a lot more ground than just does the mask fit.
It really does.
And this model, it isn't just a checklist, is it? It emphasizes how these dimensions interact.
Precisely. It's dynamic.
Like you said, long hair, an individual factor clashing with the mask, design a technological factor. Or fasting during Ramadan, a cultural practice combined with, say, summer heat, an environmental factor making it even harder to use the device. It's a truly holistic framework, forcing us to look beyond just the clinical aspects.
Exactly. This deep dive really highlights that CPAP adherence isn't just shaped by clinical factors. It's shaped by this rich tapestry of cultural dynamics, religious beliefs, family roles, social norms, how people perceive their illness, and even the environment they live in.
So improving adherence, it demands more.
It demands multidisciplinary, really patient-centered strategies that look beyond the obvious medical chart. We need to consider the whole person in their whole context.
It really makes you wonder, doesn't it? If something as seemingly straightforward as using a medical device is influenced by factors like your fear of lightning or your family's hospitality norms, what other unexpected variables are shaping our health behaviors and outcomes right across the board in all sorts of conditions?
The big question.
It really calls for a whole new way of thinking about truly personalized care, doesn't it? Not just genetics, but life.
Life, culture, environment, all of it.
So thinking about all this, what stands out to you from this deep dive when you reflect on it? Think about how these really nuanced factors might apply to other areas of health, or maybe even just daily life decisions. What seemingly unrelated element could be holding someone back or maybe pushing them forward in their own personal journey? Something to chew on.